I'm Dr. Bill Waggoner, and welcome to another Tuesday Tip. Today I'm going to talk about some tips for placing stainless steel crowns. You know, what I'm going to say may be common knowledge to some of you, but I stopped making assumptions about what people know and don't know about stainless steel crowns a few years ago. Actually, it was several years ago. I was down in the Southeast. I was doing a CE course, primarily on restorative dentistry, and there was one section on stainless steel crowns. As I finished the lecture part of the stainless steel crowns, I asked if there were any questions. One gentleman raised his hand. He said, I've been trying to do stainless steel crowns for some time now, and I'd like to get better at it. But he said, I just can't figure out how you get the pliers in the mouth to make those adjustments to the crowns. So ever since that time, I've stopped assuming that people know things about stainless steel crowns that I know. Anyway, I hope some of these tips are helpful. One of the things we do know about stainless steel crowns is that they're inexpensive, they're durable, they're fairly easy to place, and you know what? We put them on the most bombed out, hardly there teeth. We cement them sometimes in a puddle of saliva or a puddle of blood, and 3 and 4 years later, the crowns are still there and they look the same as they did the day we put them in. That is the beauty of stainless steel crowns. Now, many of us have placed enough stainless steel crowns that we can do them in maybe 3 to 5 minutes on, if we've got a great patient and we've got a really good situation to place them. It doesn't take very long, but there are always some challenging areas. And so for the next 2 weeks, I'm going to give you some tips for placing stainless steel crowns in some of the more particularly challenging areas. First of all, my first tip is, the most common crown sizes. For D's, the most common crown size is usually a 4, maybe a 5. For the E's, the most common size is a 3, maybe a 4. Most of the time, the E's, or the second molars, are one size smaller than the D's. Tip number 2, what about half-sized teeth? Oftentimes we'll be doing stainless steel crowns. We try a 4 and it's too small. We try a 5 and it seems way big. And we say, man, I wish I had a 4.5. Well, guess what? You can make pretty close to a 4.5. How do you do it? You just trim about 1/2 to 1 millimeter off the cervical margin of the lingual of the crown. What you're doing is you're basically removing the pre-crimped part of the crown, which expands the cervical size and makes it almost a half size larger. So if you haven't been doing that, try it. You just trim off the lingual about 1/2 to 1 millimeter of the cervical margin. If there are any shards from the cutting, you're going to have to smooth those off. You're going to have to put a little bit of a crimp on also when you're done. But still, it expands the size of the crown and it gives you that half size that you were looking for. Tip number 3. What happens if you have an upper second primary molar that is small? In fact, it's smaller than any of the second primary molar crown sizes that you have, and you've already prepped it. What do? Well, one of the things that you can do is you can take a size 6 or a size 7 of the first primary molars, trim it so it looks a little bit more like a second primary molar. In other words, you have to take some of the mesiobuccal bulge where it dips down on the D, and you just remove that. But oftentimes you can take a large D and fit it on a very small E crown. Tip number 4, avoid the possibility of getting an erupting 6-year molar caught under the distal margin of a second primary molar crown. How do you do that? I almost always will trim about 1/2 millimeter to 1 millimeter off that distal cervical margin of the stainless steel crown, particularly when I am in the early primary dentition. Now, if you're in the mixed dentition, you don't have to worry about it because the 6 is already up. Or if the 6 is partially erupted and you know that you're seating the crown below the cervical height of contour of that erupting 6, it's not going to get caught. But if it's still a few years from coming in, making sure that you have a well-adapted distal margin on your second molar crown will help avoid iatrogenic ectopic eruption of the 6s. Tip number 5. What happens when you've got those deep distal caries, especially on the Ds, the first primary molars, and the caries goes way down almost to the bony level? And you're saying, okay, should I extract this? Can I get a crown on here? Well, first of all, it's up to you. If there's not been a lot of space loss, you can probably restore it. Although a lot of times these teeth do require pulpal treatment, which actually makes it a little bit easier for you to place a crown and make sure that you cover that cervical margin. Because if you've done a pulp, you can do more occlusal reduction. Therefore, the crown is going to seat further cervically, and it should then cover your margin that you were concerned about. Now, the other part of it is if you're placing the crown and you're cementing it with glass ionomer and you've already done a pulp treatment, I'm not even sure if it's all that critical if there is a 0.5 millimeter of open cervical margin down there, because glass ionomer is a good sealer. You've already got your pulpal treatment done. But if you really want to make sure it's sealed, go ahead, take a little bit more occlusal reduction so you can seat the crown a little bit more cervically. Now you might say, well, Dr. Waggoner, now I'm going to have infraocclusion. Okay, well, you're right. You may have infraocclusion. Maybe the tooth will erupt a little bit more. But guess what? If you took that tooth out, instead of doing the pulpotomy in the crown, you would have the maximum amount of infraocclusion. Did you know that New Smile makes stainless steel crowns? The stainless steel crowns are surgical grade stainless steel. They have a higher micro hardness than the 3M crowns. And best of all, they only cost $3 a crown. And that's compared to the $5 to $9 that you may pay for 3M or Hugh Freedy crowns. So I know that also a lot of clinicians do a lot of Hall crowns, and I know that many of them have found that the New Smile stainless steel crowns are really ideal for the Hall crown technique. If you'd like some more information about those New Smile stainless steel crowns, go to the website or give New Smile a call, and somebody will be happy to answer any questions you may have about that. So next week I'm going to talk about some tips on placing stainless steel crowns, particularly in areas of space loss. But until then, thanks for watching, and I'll see you again next week on Tuesday's Tips.